Hello, my name is Jack Moxham and this is my cupping video assessment. Today we have Charlotte as my patient. So starting off, I'm going to go through some contraindications, aspects where you are I can't do cupping on you, or I'm I shouldn't, areas which might cause you pain or discomfort or prolong any issues. So, are you on blood thinners?
No.
Do you have deep vein thrombosis?
No.
I will not be going on any irritated skin, damaged skin, areas where you've already been cupped as well before. I wouldn't do it on that. And also, any do you have any blood clotting disorders?
No.
No. Okay, there we go. So those are sort of the main ones. If you did have any of them, I wouldn't be able to do cupping on you. So what we're going to go through today is passive, active, and glide cupping. This involves passive, where I will be putting the cups on you, moving them, but not moving them up and down, just trying to promote that suction feeling, promote the blood flow and the massage feeling, the decompression effect. Then you're active, I will be moving your arm, or you could be moving your arm, but in this case I will be moving it for you. Prolong or stretch, activate the muscle. This helps towards increasing range of motion within that area, which obviously if you're having a specific muscle which is being impinged or irritated, then this will be a really good thing. And finally, we're going to do glide cupping. This is similar, but it's a decompression effect, so increases the blood flow, but of a massage related feeling. Really good if you're having a sort of soreness or tightness around a large area. Obviously with you have a lot of you have a big case of shoulder instability, long-term shoulder issues, so we're going to be doing it on the deltoid, so just around this area here. With all that being said, do I have your full informed consent?
Yes.
Perfect. Okay, so what we're going to start with is the passive cupping. So we're going to use the rock pods, which are these. Okay, if I could ask you to go on your side facing the back wall for me. Okay, just checking the camera can see it. Yeah, perfect. So we're going to use these larger cups, which are these ones, for deltoid area. So what we're going to do is I'm going to ask you to put your arm just there for me, and then put the cup on just like that, and see that's on there. The camera can see that. Yep, so you can see that's on there. I'm just going to come around the other side just so they can see. Okay, so I'm going to lift this up slightly. That's going to promote the suction feeling, and then we're just going to move this around here, just like that. Okay, can you feel that? Yeah, is that all right?
Yeah.
Okay. And usually we do this for about 1 or 2 minutes, not long. You do see cases of people doing it for 20 minutes. Really isn't necessary, especially if you increase the suction feeling like I am now. And this can be done halfway through a session. If you're seeing cases where you feel like there might be an epicenter of tightness, or places where there are muscular knots, instead of maybe doing myofascial release, you might just want to do cupping instead, and it is better for you as well. Okay, a few more seconds. And there we go. Okay, and all we do is we just press it down and then just leave off like that. And there you go, you can see a nice one forming just there. Okay, so next we're going to do an active cupping. As I said before, this is where you will be moving Charlotte's arm within the motion that the muscle or the area that you're intending is. So for this, it will be abduction. So you're going away from the arm. This obviously promotes the deltoid muscle, but and activates it as well. Okay, so we're just going to pop back on Simari there, a little bit further up, so further down, sorry, so just there. There we go. And then we're just going to stretch. How does that feel?
Mhm.
Does that feel good?
Mhm.
Good. And what we're also going to do is we're just going to put that down again. Go all the way up. And I'm going to just drop it down again and just promote the stretch. And you could do this for all areas. If we say to do it for the back of the neck, you just bend your head. Good spot. If you would say do the back, you might round your back out. And as you can see, the cup is still firmly on there. What you can also do if you get to the end of range, you can also just activate the cup in the opposite direction. And what this just does, it does a sliding motion underneath, whereby you the cup's going in one direction and the movement's going in the direction. It's passing over each other, and this just increases all of the effects overall. I'm just going to take that off very nicely. There we go. How does that feel if you were to sit up now? Testing out sort of your different ranges. So if you put your arms like that, does that feel stronger?
Mhm.
Put your arms, say, testing that one. If you push up against me, yeah, and then if you push against me, you do feel a lot stronger on your left. And even though your left's your weaker one, it is better. Okay, so you want to go back down. So next, going to do glide cupping. Come face camera. So next, we're going to do some glide cupping. So we're going to be using some actual plastic pods now. Instead of the silicone rock pods, we're going to be using harder plastic pods, plastic cups. Sorry, not plastic pods. And just zip this up. 7 minutes, good. Okay. So right here, I have a plastic case with some pods. And what I'm going to do beforehand is I'll apply some wax, loosen up, just put some wax on the area. So I'll just put some wax here. So you just want to get some wax, or you can use oil. I personally prefer wax because I think it's more malleable and overall better. With any sort of thing you're doing, whether it's cupping, you might get some easy wax this, or you could get some strong wax. I personally have always used wax, and that's just what works for me. So what you do is you just get some wax on the area. I would never ever do glide cupping without some form of ointment. You really will just hurt the patient, which is obviously not what we're trying to promote. Make sure that you dry your hands off whilst you are doing, once you've used the wax, because otherwise you won't be able to get a tight enough grip on your, so I just have a towel here. Okay, good. So we're going to be, got a range of sizes here. I'm going to use this size, which obviously fits perfectly. I might go even a little bit smaller actually. This size would be better. So go for this size, it fits perfectly. I'm just going to go up and down, as you can see there. So you deactivate the valve, pop it on, and then give a couple of pumps there, and as you can see it's already puffed up a bit. So I'm just going to move that along there, like so. If it gets too much such like it is there, I might just decrease it. I might just pop it back on. If it's too much, you might just maybe only go for one pump. And the reason why, and then that's a lot easier on there. Like that. How's that, Charlotte?
Mhm.
And there we go. And you just lift it up like that. And as you can see, it's really flushed up at there, which is what we want when we bring all the blood to the surface. Okay, and there we go. So that was passive, active and glide cupping, all three forms within the area, promoted on the deltoid muscle, which is where Charlotte suffers from a lot of instability. With that being said, thank you very much for watching and goodbye.